Hi, welcome to Healthy Living. I'm Amy Bouton, Director of Communication and Marketing for St. Tammany Health System. Today on Healthy Living, we're going to talk about summertime care for you and your family and all the things we have to offer. And so I have three special guests joining me today. We're going to start with Stacy Foster. Stacy is our Director of St. Tammany Physicians Network and Primary Care Clinics. So welcome, Stacy. Thank you so much for being here with us today. So tell us a little bit about you, first of all.
So I started my career at St. Tammany Health System 16 years ago as the manager of the Covington Primary Care Clinic. And I'm happy to be here to share with you and everyone how we have grown and we continue to grow.
We are in a large period of growth right now, which we'll talk about in a little bit. So what's your specific role with the health system now?
So I am director of all of our primary care clinics. We have 4 of those clinics currently, Mandeville, Madisonville, Covington, and Folsom.
Okay, so when we say St. Tammany Physicians Network, and we specifically talk about primary care, that's exactly what it is. It's a network of care for your whole family, really.
Correct.
So just kind of elaborate on that a little bit, if you don't mind.
It encompasses family care, family practice, as well as pediatrics. So in our 4 clinics, we have 35 physicians, and I'm happy to share that we will be growing and adding 4 new physicians over the summer.
Oh, great. So that's more access for more folks. So tell us about the locations, particularly the ones that you are director of.
Okay. So Mandeville, Madisonville, Covington, Folsom.
Okay.
All primary care. We see all ages. And in the Mandeville and Madisonville location is pediatrics. Okay. We've encompassed those 2 into those clinics.
All right, so let's talk about that for a minute, pediatric care. So how many pediatricians do we have on staff at St. Tammany Physicians Network?
Currently we have 5 pediatric physicians in Madisonville and Mandeville.
Okay.
Our goal is really to have primary care and pediatrics closer to home.
And that way, when you go with your child, you can possibly squeeze in your adult appointment as well.
Absolutely.
Okay.
Absolutely.
So what does that look like? If somebody wants to get in with a pediatrician, how do they start with y'all?
So we have access through MyChart, our website, and call in our number. It's 898-4001. And just reaching out, and our website actually has all of our physicians, so you can, study that, read it, and learn who we have. And our staff is happily to schedule. Okay. We're in clinic Monday through Friday, 8 to 5, and then we do have express care, which is after hours and on weekends.
Okay, and express care can be for adults and for children, correct?
Absolutely, yes.
Okay.
Yes.
All right. So when you talk about both clinics and the pediatricians that are available, I know as a parent, when my children, especially when they were younger, sometimes they just wake up and they'd have this random fever, or they'd be sick, or they'd feel ill, and I would want to get in the very same day. So what is that like? What does that look like for a parent?
So we have same-day access, and our pediatricians understand that kids randomly will have those kind of symptoms, and in the middle of the night, early mornings. And so we do have same-day access in both clinics, and also walk-ins are welcome. Okay. We make sure that there is availability. Again, in the middle of the night, scheduled appointment can be done on MyChart 24/7.
Okay, so if your child does wake up in the middle of the night 6, just get online and plug in that appointment. Well, that's great. So let's talk a little bit about primary care for adults. Okay. Okay, so what does that look like?
So our primary care clinics, we do, obviously we have, our goal is wellness visits. We want to keep our patients well. So we do, recommend everyone come in once a year and have that wellness check. Make sure you get all those screenings done. And then we also, obviously have acute care. And so those physicians as well will keep some availability on same day so that we can see those patients same day. Okay. We also have express care, like I said, which is our after hours primary care. We're open Monday through Friday, 1 to 9, Saturday and Sunday, 9 to 5.
And we were actually talking about express care yesterday because my family used it recently for my daughter, and it was very convenient because she didn't get off work until 5, and she didn't have enough time in the day to make a doctor's appointment and see a doctor during her lunch hour. So she went in there and she used the Express Care. And we were talking about not just for acute things, but also for your primary care visit that you were just talking about. Tell us about that.
Correct. So if you need to be seen, and everybody has a busy schedule, and sometimes normal office hours aren't convenient. So we do office hours after. You can do those wellness visits. You can, if you're being seen regularly by a physician and, you need a med refill that potentially, you can't get in during those office hours.
Right.
We're welcome to schedule them during those off hours.
And this is a primary care clinic. So that is different from an urgent care, which affects the way you pay your bill.
Correct.
Okay.
We bill as a primary care clinic, not an urgent care. So in some cases, patients, have different levels of copays based on what they're billed as.
Right.
And so our clinic is a primary care clinic. And so we bill as a primary care copay.
And I think another plus to the primary care, even if you do go to Express Care after hours, is that all of your records are in there. So if you saw a doctor at another primary care clinic, the doctor that's at Express Care,
correct, is able to access your previous visits, medications, and any other testing that may have been done prior to by that primary care physician. We also at Express Care do point of care testing, which will include COVID tests, flu tests, strep, mono, and urinalysis. So
full care.
Yes, so you're able to do that in that clinic.
Okay. Well, that's good to know. Now, where is the Express Care Clinic located?
So our Express Care Clinic is at 80 Gardenia Drive, which is in Covington. We're about a mile away from the hospital. And, we like to say that, if there's a non-acute issue that, you don't need to go to the emergency room, Express Care is that option.
Yeah, and it's a great option, like we talked about, because it's not the urgent care, and it's going to be familiar doctors
Correct.
to you. So, and familiar staff.
Yes.
We also have something that we want to touch on pretty quickly called Virtual Care Now. So what is Virtual Care Now?
So Virtual Care is our online appointment using an iPhone, smartphone, and going through the MyChart app, where you can have an office visit from the convenience of your home or work, lunchtime, and be able to get that visit in for non-acute issues. Some symptoms could be cold and flu, allergy, sinus, urinary tract infections, pink eye, stomach aches, and even rashes. Because you're doing it virtual, they can see that rash and be able to treat you.
Okay.
And we offer that Monday through Friday, 9 to 9, and Saturday and Sunday, 9 to 5.
Okay, so that's a wonderful option, especially in the summertime.
Correct.
We're all active. Stuff happens on the weekends.
Right. Right. Yeah. And so it's an option that, you can't get to the clinic or just a quick virtual visit. We want that to be an option. So, and that can be booked on MyChart or through our website or by calling 898-4001.
Okay, wonderful. Is there anything else you want to add before we wrap up?
So I think too, we also want our patients to know that we are expanding. We're wanting to bring their care closer to home, closer to work, because we are in Mandeville and Madisonville and Folsom and Covington. And because you see a physician in Mandeville but you work in Folsom, you could basically, if you needed an acute visit, could be seen in either office. And your records are there. Your primary care doctor can see if you saw one physician, and then that physician you may be seeing just for that one-time acute visit will be able to see those records from your primary care physician.
Okay, so we got you covered.
Yes.
It's a network, and we are going to take care of you within that network.
Correct.
Depending on your needs.
Yes, and any testing, even emergency room visits, if you're seen in the emergency room visit and you need a follow-up, all those records are in the same system, so we're able to see everything and get the whole picture.
Continuum of care. That's good.
Yes.
Well, thank you so much, Stacy, for joining us. And
Thank you.
talking about the primary care clinics, and we appreciate you. We will be right back, and we're going to be with Joe St. Philip. He is our Director of Emergency Services. He runs our Mandeville Emergency Department. So we're going to talk to Joe in just a minute, so stay with us.